Hey everyone, this is Jeanette Blood, and the career that I chose to research for a career exploration presentation is physical therapy. So let's dive right in. What is physical therapy? Well, a physical therapist is a person who provides care to people of all ages who have functional problems due to injury, such as broken legs, or neurological disorders, such as a stroke. PTs use their knowledge and training to come up with a plan to rehabilitate and treat patients that have chronic conditions or injuries. What do physical therapists do? Well, normally when a patient comes and seeks the help of a physical therapist, they've already seen a doctor. It is the physical therapist's job to go over all of the doctor or the surgeon's referrals and notes to make sure that they understand the patient's medical history. Once the PT has all of the notes from the patient's history, it's time to get to work. They usually have the patient walk, stand, or move so that they can observe and see where the concerns are. Another thing they really have to do is they have to pay attention to what the patient is saying. They have to listen. Once a PT has understood what the exact problem with the patient is, it's time to set up a plan. The plan usually consists of exercises, stretching, hands-on therapy, or use of equipment to help ease the patient's pain, to help increase their mobility and their functionality. This will usually help decrease their pain and strengthen their body so that they can prevent future injury. Once the patient has begun to follow the program, it is time for the PT to evaluate the patient's progress, modifying the plan as necessary. Another important part of the process is to educate the patients and their families about what they need to expect from the program and how to best cope with the recovery process. In order to be a successful physical therapist, there are a few personality traits in which you have to be strong. Compassion is probably the most important. You have to have a desire to help people, to want to work with people. You have to have empathy so that you can help them. Without empathy, the patient might think that you don't care about their well-being or their progress, which likely isn't the case. If you chose physical therapy, you did so for a reason. Being detail-oriented is also very important. You have to have the ability to observe and analyze your patient's movements and problems, and then provide safe and effective care. Dexterity is another trait that's important in a physical therapist. A lot of times you will need to physically touch or move your patients to assist them in their physical therapy. If you're one of those people that are put off by touching someone, physical therapy is probably not the career path for you. Because you'll be spending a lot of time with your patient, it's important that you have interpersonal skills. You want to enjoy working with people so that the patient doesn't feel like they're just a drain on your time and energy. You want to be able to explain things effectively to your patient. You want to be able to motivate your patient. And when your patient has any kind of a concern, you want to be able to convey that you're there to help and to listen and to modify as necessary. Physical therapists spend a lot of time on their feet. They move along with their patients as they attempt to progress throughout their program. You should enjoy some form of physical activity, or at least not completely hate it, in order to be a physical therapist. A physical therapist must be resourceful. Every patient is different, and every patient has different needs. You need to be able to adapt and grow along with your patient. The advantages of being a physical therapist are abundant. You get to truly make a difference every single day in the lives of numerous patients. In helping them through their programs and motivating them to do better and push harder, you're giving them back their independence. You're giving them back their mobility and their ability to function. Functionality is something that we all take for granted, and watching your patient progress day to day is truly gratifying. The physical therapy field actually has a variety of fields in which you can choose from. You can choose to work with children or veterans, sports figures. There are a number of different fields that you can find some sort of interest in. Job security in any field is a huge advantage. Because physical therapy has such a broad spectrum of different jobs, finding another job at another facility should not be difficult. And quite possibly the most attractive advantage of being a physical therapist is you get to be your own boss. A lot of physical therapists leave their jobs to start their own practice or at least be a partner in their own practice. You can practice how you want, you can do what you want, and you can do it when you want. If there are advantages, unfortunately, there are disadvantages. One of the biggest disadvantages to physical therapy are the years that it takes to acquire your degree. You have to have a college degree, and you also have to have a postgraduate degree. Another downside is it is physically demanding. You are on your feet all day long. A lot of the time you have to help support your patient's weight. It is very hands-on. You use your hands all day. It is just stressful on your body. It can also be emotionally challenging, and this one might be the worst for people like me. There are some patients that will just flat out refuse to follow your outlined program. This could be an issue because you created this program to help them. If they don't follow it, then you can't help them. Sometimes patients will get frustrated with their own lack of progress. Try as they might, sometimes progress will be a lot slower than what you expect or than what they expect. Their emotions will mirror yours, and everyone just ends up frustrated. The biggest downside is probably witnessing your patient in pain. Physical therapy is sometimes very trying and very hard, and you will see that your patient is in pain with every movement. For some, that's just too much to bear. The median pay for a physical therapist is about $79,000, with the lowest being $55,000 and the highest being about $112,000. The employment outlook for physical therapists is actually projected to grow about 36% from 2012 to 2022, which is a huge percentage, with most occupations only growing about 11%. This is mainly due to baby boomers who will be growing older and will need more help from physical therapists. In order to be a practicing physical therapist, you have to be accepted into a program for physical therapy that offers a Doctor of Physical Therapy degree or doctorate. Once you have obtained a doctorate degree, you go on to start your clinical internships, normally at a hospital. From there, you go to a clinical residency program, which usually takes about a year and aids in additional training and experience in your special area. Perhaps one of the most interesting things that I've discovered about physical therapy is that there are so many different kinds. You can't get bored. There's something for everyone. Pediatric physical therapy mainly works with children. You get to help adorable children improve their motor skills, balance, coordination, strength, and endurance. There's also neurological physical therapy. This is normally where you get to work with older people who have Alzheimer's or some form of a brain injury. You get to help people with cerebral palsy, multiple sclerosis, or Parkinson's. Anyone who's had any kind of a severe spinal cord injury or stroke. And perhaps one of the most interesting forms of physical therapy to me personally is orthopedic physical therapy. You get to work with sports figures who have sustained serious injuries. Think football players, basketball players, hockey players. You can personally work one-on-one with them to help them become their best. You can also work with people who have severe forms of arthritis or any debilitating issues like that. And finally, you get to work with amputees. Think American veterans. Think survivors of diabetes. People who have truly had something physically taken from them. You get to help them navigate their lives in a new way. You get to help them become mobile again. I can only hope that I've highlighted the incredible opportunities that physical therapy offers. It is truly fulfilling and gratifying work. I cannot wait to get started. Thanks for listening.